Welcome to Heartbeat on Zimbabwe's television network, that show that brings you all things health and development, because your health is your wealth. My name is Robert Mkondiwa, and we would like to thank our partners, the UNFPA, SAYWHAT, and the Swedish Embassy in Zimbabwe for continuing in sponsoring this program and helping to amplify the voices of millions of people around this country who otherwise would not have a voice and say in things and issues that affect their own lives directly. Now, as the COVID-19 pandemic continues to wreak havoc across the globe, young people have not been spared. They have not only been affected, but also infected. But they have been negatively impacted by COVID-19 through the support of our partners. We've had that opportunity to give those young people a voice by speaking to those who have been infected as well, to get the insight on the lives that they are living and how they've been impacted. Now in studio today, we're privileged to be hosting Dr. Shingi Bopoto, the former Secretary General for the Zimbabwe Medical Association, ZIMA. Dr. Bopoto will give us his own perspectives and views and recommendations on the country's response to COVID-19 as we unpack the topic. And also we have SAYWHAT Director Jimmy Wilford, who is with us here today as he continues to unpack issues of young people and COVID-19. Penelope Kasere, UNFPA's Adolescents Sexual and Reproductive Health Program Analyst, is also in the studio with us. We shall be later joined in studio by a student, Thabo Dube, because of course, what is student issues without bringing the students in themselves? But enough of that. I've of course introduced you, but perhaps for our viewers to put a name or at least a face to the names that I stated, I'll start with you, the gentleman. Welcome.
Thank you, Robert. Jimmy Wilford is my name, from SAYWHAT.
And why are you in this matrix? How are you in the matrix of students and COVID-19? What work do you personally do around the issue today?
SAYWHAT works with students who are in the tertiary institutions. Just like any other member of the society, the students are equally affected and also infected with COVID. And right now, students are not, we're supposed to be in school. They were supposed to be within their respective tertiary institutions, but they are out of school right now. And that has also raised a lot of anxiety among the students. And on the other hand, some colleges have been communicating with students, inviting them to come and attend classes, and some were even complaining that they're just being threatened that they are supposed to be attending e-classes, and some they're saying they don't have enough facilities and infrastructures and enough resources for them to access. And already they are being told that failure of you attending this or fulfilling these requirements, you are not going to continue with your studies. So here we are as SAYWHAT to ensure that we bring the voices of the students on the COVID agenda and engage with the society so that we can find some lasting solutions to the challenges that the students are facing. Because on one hand, the authorities are saying something else, and when you go on the ground, you realize that students are supposed to go back to school, 4 years, so they say, and the 4 years they are concerned, how they travel to their respective colleges, things like that. So that's why we're here as SAYWHAT as an institution.
Thank you. Now, the lady, welcome to Heartbeat, and of course, thanks to your organization for helping amplify the voices of the youth. You could just introduce yourself, what work you do with young people and adolescents, and of course, where you find yourself in the COVID-19 matrix.
Oh, thank you, Robert. I'm Penelope Kasere, like you previously mentioned, and I'm with UNFPA as the Adolescent Sexual and Reproductive Health Program Analyst. And the work we do as UNFPA as it relates to young people are at the center of the work that we do. Not only within the COVID, but in ensuring in general that their potential is fulfilled in every area of their life. And especially at this time when you're looking at the global pandemic, it has had daunting effects and challenges as it relates to their health and socio-economically as well. So very much so, we are very much interested because it really impacts not only their health, their education, their social engagement, and even their livelihoods. So we're really here to give us support and to ensure that young people are not left behind and are really engaged in the conversations, and to engage them as part of the solutions to how can we move forward as we are facing this global pandemic.
Thank you, Penelope, and it's a pleasure to have you here. And finally, our good doctor, state who and what you are, and of course, where you find yourself in this particular matrix.
So I'm Dr. Shingibokoto. As you mentioned, I'm the immediate past Secretary General of the Zimbabwe Medical Association. I currently work as a surgical pathologist at Harare Group of Hospital, and I'm in the COVID rapid response team for Harare Hospital. I also do some work at private laboratories. So my current role at the moment is multifaceted, both advisory, diagnostics, as well as responding, and a bit of research.
Well, thank you. And indeed, it's probably the first time we've gotten somebody really in the thick of things with regards being part of the rapid response team. And we'll have quite a number of questions, I'm sure, not only just me, but I'm sure even my fellow panelists here who at least want to find out what's been going on. And we've got quite a lot of lessons that we may learn from you as we go forward. Thank you all, and welcome to the program. Now, this week, we'll be wrapping up on a topic that we started last week, of course, at the behest of the UNFPA, the lived realities of young people and COVID-19, as we continue to give these young people a voice in this era of COVID-19. There has been talk that, of course, that government wants to reopen universities, observing social distancing, for example, for especially the final year students who are supposed to be writing. Now, some universities, as Jimmy has said, have already made arrangements to open, with some students already having traveled to their respective learning institutions. Now, we have been interrogating that thought over the past couple of episodes and questioning the wisdom or lack thereof of that idea. Now, the assumption seems to be from government that students will be negative and it will be in their best interest to write and finish their degree courses. But again, we have been proven right. How? Well, recently, 3 final year and a National University of Science and Technology students tested positive for COVID-19. They had been tested in a class of 21. Now, imagine if they had not been tested. The results could have been catastrophic. Now, can the government test 300 development students, final year students, for example, in Midland State University, or maybe human resources students in a class of 150? Your guess is as good as mine. We found this out because they were just 21. Had that number been bigger, we would have had a mess. Now, following that revelation of the 3 positive tests in Bulawayo, where we actually went alongside SAYWHAT and UNFPA to meet these students, with the support of our partners, as I said, most notably SAYWHAT and UNFPA, we managed to talk to the trio. Now, the medical students who are still processing all this are trying to understand what this infection means to their lives, and they spoke off camera sharing their fears. Now, the students who are, as I said, in their final years, are hoping to finish school in the next few weeks, but that has been suspended. Now, school for the other group of the 21 has also been suspended for 2 weeks as the university is still processing the developments. Now, let's see what Bulawayo had for us when we went and caught up with the students. And we're here in Bulawayo at the Elangeni Institute of Training and Development. Of course, it is here that many returnees are being housed. Many of them are being found to be COVID-19 positive after being tested. It is also here that there are 3 students who came back hoping to finish school as medical students. But unfortunately, when they were tested, they tested positive. Of course, we are not going to be giving you further details because of confidentiality issues. But it is here that they stay, obviously traumatized, obviously trying to come to grips with the fact that indeed they are positive, and they were looking forward to writing their examinations, but that is a dream deferred. And what irony, what greater irony is there than being housed here at Elangeni, which means the sun. But certainly at the moment, there is no sunshine in their academic lives. Penelope, that is a reality. That is what the adolescents are going through, and they're in these quarantine centers. And As an organization, what sort of support would you want to lend to this demographic, especially at a time as dark as this? Because this is obviously unprecedented.
Very true, Robert. Thank you. I think a platform like this is actually one of the platforms that we really are happy to support, because it brings up the issues and how best can we be able to support this target group. And as UNFPA, working through even through the UNFPA Global Response, and even through in partnership with the government of Zimbabwe in the National Response Plan, you'll find that we are actively involved across all the 5 pillars of the National Response Plan with regards to the monitoring, coordination, planning efforts that are currently in place, infection prevention control, case management, and even the procurement of logistics and commodities that are required to help manage this situation. So you find that for us, our greater interest also now centers around what's happening with young people. And as UNFPA, we have, through support of our implementing partners and through government, we have tried to reach out to raise the awareness and to bring the issues to table so that they can be addressed.
Well, certainly you mentioned something that's absolutely important. We want to know what is happening with our adolescents as they're going through these very, very dark and traumatic times. I'll come to you, Doctor, because I went to this place, to Elangeni, and as I said, there was no sunshine there, because there's a lot of attention, there's apprehension. There are children and adolescents, people who have not really ever experienced this, but they're now stuck away from family, away from their support structures. And you have been in the eye of, as it were, of the response. And you know what places like Elangeni have and their deficiencies. Do you think we're doing a great service to our adolescents with regards to the areas in which we're quarantining them? And do you think we are giving them the adequate support structures for them to get through this dark time?
Truthfully, obviously, we are not doing enough for all people infected and affected by coronavirus. Now, places like the one you mentioned, the other isolation facilities, use communal bathroom facilities, communal dining halls, and so on and so forth. And the way that this disease spreads, I think it is well known, is droplet infection, and it can survive on certain surfaces for several hours. What are the desanitation procedures in these places? We don't have those guidelines. But what is particularly concerning to me as a medical practitioner is that these are medical students who, from the information in the public domain, got infected in a hospital. Right. So how did they get infected in a hospital? And we are now bringing them back to write exams. And their examinations are not just written examinations. They've got a large component of practical examination, where they actually examine patients. Did they have PPE when they went into the ward? Would they have PPE for their examinations? All those information we do not have. I'm aware that University of Zimbabwe and NAST did test their students, but that's not enough. Do they have adequate PPE? Now, there is recommended PPE for certain scenarios, but a large component that has been neglected is the mental health aspect of these students. So here we are talking about a deadly, highly infectious disease, and you are telling a young person who was expecting to be treating people next year that you have got this virus. Have we sent psychologists to these young people? Have we sent counselors to these people? And to their families who were looking forward to celebrating a graduating doctor next year, what psychosocial support have we given them? And are they in a state to write the examination when the quarantine period ends? The other thing also that I'm a bit confused about is that, are these students symptomatic or they are not symptomatic? The fact that they are in a quarantine center implies that they are not symptomatic. They are being isolated from their families and their cohort, so to speak. But we would really want to know whether these students are symptomatic.
Well, you touched on, before you go any further, you touched on something very important with regards to mental health. And this is something that we seem to neglect. And I want to come to Jimmy because when we had the privilege, of course, of going to Bulawayo, we had the director of SAYWHAT with us. And when Jimmy, you came out of having met those young men, and you were already in a state, you were not positive, but just speaking to them and seeing how they were mentally affected you as a person, and you came out saying, looking traumatized, feeling traumatized, and it took you quite a while and to get back to your element, as it were. As SAYWHAT, what do you recommend? What do you think should be done to assist in the mental health aspect? Because if you can just look at somebody and talk to them and get affected that much, imagine what's going through that person who is living that reality.
Well, Robert, I will start by possibly engaging Doc. What he raised is something that is within the public domain. What I seem to have picked in terms of what might be correct in terms of what happened to the students is that the students were at home, like anyone else was locked at home. Then the students traveled to their respective faculty. Yes, the faculty of medicine at NAST is based at Mpilo Hospital, just like the faculty of medicine at UZ, which is based in Paranyar. So I'm not very sure if it's correct to say that they were infected at Mpilo Hospital. It's something that no one really knows, but these students traveled back to complete their studies. Actually, they are left with 6 weeks for them to write their final examinations. So the condition was for them to start classes, everyone was going to be tested, the 21 of them. Then out of the 21, 3 of them tested positive. Then the classes were stopped. Okay, let's isolate them. And it's true, they are not symptomatic, because I spoke to one of them. I spoke to them and we saw them. So it's like they are in that isolation center, and indeed, well, like what Robert is saying, they are traumatized, confused, wondering what is going to happen, you see? Because like they would say, I came here just to complete my studies, to prepare for my examinations, and here I am, I found myself in this kind of a situation. I'm processing a lot of things. So indeed, there is a lot that needs to be done collectively. SAYWHAT as an institution might go that far. Government as the principal right order, they need also to really do something about that. Partners like UNFPA can come in and find some collective ways of assisting the students. More importantly, there is need also for the students. There is a lot of stigma that is around COVID-19, and for us to deal away with the stigma, it requires collective responsibility within the society. If there is enough information for people to understand what does it really mean for somebody to be the coronavirus positive, that way it can really even help in easing stigma within the society, and people can speak about it freely. So that's what I think can easily aid into addressing the mental torture that might be there. Because the mental torture, there is self-stigma, and there is the societal stigma again. So this again can be dealt with by making sure that we provide as much information as is possible to the society in a properly packaged manner, such that people get to understand what does it mean. I like what you really said in terms of how the virus can survive on various surfaces. It's something that we are taking for granted. Take, for instance, if one is to imagine, how did these 21 students travel from their respective homes to Bulawayo, given that there are some transport challenges? What really happened? Even if other colleges are to open, what is going to happen if the grade 7s, Form 4s, Form 6 are to go to school? How are they going to be traveling to their respective schools? How are they going to be living within those particular schools, etc., given what the scientists are telling us in terms of how the virus can survive on various surfaces, on a rubber, on a wooden platform, etc.
I'd like to come in. Now, he's raised a significant point, but which needs to be interrogated further. We've got 3 students, medical students, and a patient who tested at Mpilo positive in the same batch of tests, right? There is a possibility that these students came from wherever they came from. with the virus, or they got infected during the transportation process, or they got infected at the hospital. Now, if they got infected at the hospital, then that's fine. We know that's an isolated event for the patient, that's the source patient, and the 3 students got infected from that patient. But these are 3 students who come from 3 different geographical areas. If we are not sure how they got infected by now, then we are perhaps not worth our salt if we're in leadership positions in those scenarios. We should have known that they got infected at home and we do appropriate contact tracing, because then that would mean there's somebody in the community with the virus. But the information, the way it was presented and the way I interpreted it, I understood it to mean that
that they got infected. But in general, back to you, working in the rapid response team, I don't know whether you're even rapid, that's what I want to know. Are you fit for purpose? Are you doing, of course I did ask the doing enough part, but what needs to be done with regards to the response to COVID-19? Because we see that we are lacking, but where exactly are we lacking? Because you might be within the thick of things, you might be within an institution, but even from inside you can see that we're doing this wrong, we're getting this wrong, we're not fit for purpose.
Yeah, without blowing our own trumpet, Paranayathwa Group of Hospital has done a lot of work. It's now a 2-in-1 hospital. It's got about 360 something beds that have been set aside for COVID positive patients who need other medical care, and then the other side with another, I think, 700 or so beds for the general medical care. Where are we lacking? Everything succeeds and fails at leadership. Our leadership, do they understand the gravity or the magnitude of the problem that we are currently dealing with? It was announced that we were targeting, I think, 15,000 tests per month at some point. How far away from that target have we even reached a tenth of that target? And 90% of the things we are using are donor funded. Very little of our own resources are actually being used. Then demotivated staff, I think you saw what happened yesterday to the Paranayathwa Group of Hospitals. Then the perennial shortages of PPE. All right, those things are leadership things now. But on the ground, people are doing what they can with what they have. So for me to say we are doing this wrong, it would be unfair to somebody who is improvising so that they can offer a service.
But being part of that rapid response team, what are you doing to engage the leadership to say, wait a minute, this is what we need if we're to succeed, if we're to become a greater success story than we are at the moment? These are the fundamentals that need to be right.
Right. There are various doctors, nurses, and other medical professional associations that sit in advisory capacities and advise the government. I mean, for the information pillar, for example, this kind of information is required. For example, our quarantine centers, our isolation centers for detainees, we get information that 10 people, detainees from South Africa, tested positive. Okay. But out of how many detainees, what is the rate of positive tests among our detainees? Right? That information we do not have. We want that information for planning purposes. The tests can take up to 5 or 10 days for somebody to get a result, and that is putting somebody in prison. We don't know whether you're going to be positive.
And it's a mental prison as well, because you can't be waiting for 10 days for certain results, especially with such implications on your life and your livelihood.
Yeah. Then our recovery rate, we see again on the bulletin that the Ministry of Health publishes every day that we've had 2 recoveries. Again, now these are 2 recoveries from what? Are they recoveries from somebody who was symptomatic, in other words, somebody who was ill, or recoveries for somebody who tested positive and now tested negative? And our recovery rate appears to be very, very, very low compared to to other countries. But again, what are we talking about? Recovery from symptoms or recovery in the sense of
from illness?
Testing negative. Okay. So those are areas that we would want our leadership to address, to focus on. Then I will also need to emphasize again equitable distribution of personal protective clothing. Right. In a scenario like this, social distancing with a mask is sufficient. Right. Then for people who are looking after patients who may have COVID, that's when we need the so-called N95 masks. But we see our leaders in public wearing an N95 mask. That's inappropriate use of PPE. It's inequitable. A surgical mask or a cloth mask is sufficient from what WHO has said for general public use. But for me, when I'm in a hospital where I might meet a patient with COVID, then I need the N95 mask.
So practically you're disillusioned when you've got a cloth mask and somebody who really doesn't need it is wearing the N95. Yeah. I'll come back to you because there's something that happened here. When you spoke of information, Jimmy, adequate information, and this is something that UNFPA does when you're dealing with adolescents and young people and whatsoever. And you've been doing this with finesse. We've been faced with certain things like HIV and AIDS, which was really a catastrophe when we were growing up, but which is something that we've managed, which is, and we've managed the information and the information packaging. It's something that we've managed to live with alongside, and we know what messaging to give. Now, this is uncharted territory. It is as COVID-19. There was a lot of shock, there was a lot of awe. There's a lot that's happening because we're learning each and every day. How does that impact your line of work when you're dealing with adolescents? Because what you have told somebody today will maybe be altered tomorrow. And I'm going to give you a follow-up if you answer me this, because something has really triggered this in my mind.
Okay, thank you, Robert. I think, like you rightly say, this is uncharted territory, and it's, for us, it brings in the perspective, even from the information that young people are getting. People are getting information from all sources of, like there are a lot of information sources, some reliable, some unreliable. And as UNFPA, we have always supported the production and supported the ministry and government to produce data through the census, Zimbabwe demographic survey reports, and all those and many other researches. So data is one of our key areas, and even right now we are really supporting the monitoring, the reporting, and even the collection of the data that's happening currently, even in this COVID response. But suffice to say that I think I would love to highlight that this kind of information has, that's what also has led us to even support a platform like this, and even implementing partners like SAYWHAT, to say young people are not invincible. If you remember very correctly, like when this whole global pandemic started, it appeared to be COVID as a disease for the old, a disease for a certain target, and young people kind of felt safe and not so much affected. But looking at data and trends, we find young people can be transmitters, young people have been affected, and documenting is part of the work that we are doing. And even the going to interview the affected students, what have been their responses, what needs do they face, and what other psychological maybe support services do they need. It's also bringing all these things to light. Even looking at the episode that you had last week, we already as partners gleaned a lot from the experiences of families, how they reacted, and even of the adolescents and the young people, and what other kind of support services might be required. Maybe for information, we're already supporting like on top of the national COVID response line 2019, we are also supporting the youth helpline. So that it specifically deals with these issues and offer the psychological support services that adolescents may be experiencing and that are specific to adolescents' needs. We've also even I'm
hoping I'm not putting you on the spot right now. Okay. But from the top of your head, off the top of your head, would you know the youth helpline? number.
393.
393. So there you have it. Wherever you are, if you are affected as a young person or even possibly infected, 393, that is the number to call. It is toll free, and of course it's supported by our partners, UNFPA. But go ahead.
Okay. Yes, I was also maybe wanting to highlight the other challenges that we have learned as the global pandemic is evolving. Issues to do with increased cases of gender-based violence, for example, and through the general toll-free lines and even through the youth COVID line, we have noted an increased number of cases being reported there, and that has also informed even our support to increase the capacity of the toll-free lines for GBV, say through MSASA and other partners that work within gender-based violence, to try and really also increase capacities, not only in terms of offering the psychological support for the mental wellness of those affected, but even increasing the capacity in terms of resources at the one-stop centers, the mobile one-stop centers, the shelters, the safe spaces, because we are also increasing other indirect consequences from this COVID.
And why I asked about the whole thing about information is, I'll come back to you, Doctor, with regards the medical intervention that we got off the steroid. Perhaps you may have it at the top of your head that yesterday we heard would assist in at least around 30% of cases of those who are ill of COVID-19, the United Kingdom, of course. And I was following the reaction to the news in South Africa, for example, and how yesterday President Ramaphosa was speaking about the same intervention, the same steroid, as if it's a silver bullet. And people are very, very optimistic. And yet, also, if you really go down to the stats and the facts, they're saying it has little to no assistance to somebody who's not asymptomatic. But people seem to think, okay, we're fine already because something has happened, and we found that this intervention can assist. And that's why I was saying information. Because if that information is not packaged correctly, you will have people walking around willy-nilly without any masks and everything and saying, well, we're told there's this steroid, Mshongapo, hey, it's a brand new, easy, simple day. How do you respond to that?
Yeah, it's a major source of concern to us as medical practitioners. I mean, we heard again in the public domain that the President of the United States was taking hydroxychloroquine,
yes,
which is a drug that is widely available. We used to use it for malaria, and then of course malaria became resistant to it. Then we were obsessed, after again information that is in the public domain, the Zororo Makamba issue, we became obsessed with ventilators. Thank you. Now, overall, about 20% of people who get coronavirus infection will develop symptoms that warrant hospitalization. And out of that 20% that are hospitalized, a smaller percentage will require assisted ventilation, either supplementary oxygen as well as mechanical ventilation. But people were obsessed with ventilators, thinking that the moment you are coronavirus positive, you need a ventilator.
But before you go further, because I was actually going to come with the issue of the ventilators as well to you, because people thought, well, you're not well, and the story that went round was, had Zororo had a ventilator, he would have still been here today. But that's not particularly true, because I wanted you to then take us through that extremity, Kuti. In order for you to then be put on a ventilator, things will be how bad, and also how somebody is put on a ventilator, because it's a very uncomfortable and very painful and not a very simple procedure, because people would hear ventilator and think they put something over your mouth and you just start breathing. It's a lot complicated, a lot more tubes, a lot more strength than that. And from what I learned, Anthony Fauci was saying perhaps at least 3 surgeons needed to shove uncomfortably things down your anatomy.
All right, I would not want to say uncomfortably, because this is a life-saving procedure. I will address that, but let me just complete the dexamethasone story. Now, what they have discovered is that among ventilated patients, so these are patients who are, number one, they are part of the 20% that require hospitalization. And then in addition to that, they are part of the percentage that require assisted ventilation. They have found that in that population, it reduces the risk of dying by 30%. Now, this is not a treatment, right? It's we are managing a physiological response of the body to the virus that ends up damaging. So we are not killing the virus with dexamethasone, neither are we killing the virus with hydroxychloroquine. We are managing certain complications that are caused by the virus. So at this point, there is no drug that treats coronavirus. That is an important message to put out. There are drugs that have been shown to reduce the severity of the symptoms or of the complications. So that is what dexamethasone is. Yeah. And by the time we need to use dexamethasone or the steroid we're referring to, you have reached a stage where you need ventilation. Now, being a steroid, we are not just going to use it willy-nilly because it can have other effects. Now coming back to the issue of ventilators, right? Again, this information was put in the public domain wrongly, and I'm partly to blame for it. As a medical practitioner, I should have done my best to try and correct it. We need ICU functionality, intensive care functionality, of which a ventilator is just one component of ICU functionality. Wilkins did not have ICU functionality. So even if we had a ventilator at Wilkins for Zororo, it was still probably not going to make any difference, because for us to have ICU functionality, we need what is called an intensivist. This is a specialist physician, or in Zimbabwe we use anesthetists as our intensivist. These are people who are able to calculate that for your body size and height, we need to put in 200 mils of air through that ventilator. Then they put catheters or cannulas or tubes directly into your heart so that we do your fluid balance appropriately. Then positioning the patient, I think you might have come across this, that in Europe, in UK in particular, they found that patients who are ventilated and they are put prone or face down seem to do better than patients who are nursed, supine or face up. So this is the functionality that Zororo would have needed. And the ventilator alone would not have given us that functionality. Then we also, in addition to the intensivist, would need ICU trained nurses. That's an additional year of training over and above the 3 years they currently do. How many of those do we have in this country? And how many ICU beds with all the monitors that monitor your breathing rate, your blood pressure, your pulse rate, your oxygen saturation? How many of those do we have in the country? At Pararenyatwa right now, as we speak, our installed capacity is 27, but our ICU functionality at this point is 4, because we don't have equipment. We only have equipment for 4 ICU beds.
So it's, it seems as, and this is what I wanted to bring out, for example, that it is a lot more complicated than we seem to think it is. And leaving you, Doctor, just a second, I want to come to you, Jimmy, and say, you're going around, you've not stopped, you're going around to other areas, you're going Bindura, to other nearby institutions like Chinoyo University, and some have started writing already, and they're in this matrix, they're in this area where they're scared. You talked about how a lot of them are saying they're being coerced to go back to college. What is SAYWHAT doing to help handhold those people? Because you've been working a lot with these students, and there's a lot of apprehension.
Maybe what I can do right now, even on behalf of SAYWHAT and the students, is possibly to check with the doc to make him comment on the relationship between COVID and this winter that we are in. And a lot of young people that are following this program right now, these young people, there has been some myth around winter is coming, etc. So Doc, possibly, can you comment so that you can possibly provide that information to the young people who are watching this program right now in terms of the relationship between COVID-19 and the cold that we are in. Today it was very cold as well, and we are still going to have some very cold days coming.
The expectation is that cases might spike in winter. That is the expectation. But that does not mean that the virus itself changes its behavior because we are now in winter. But several risk factors come together during winter. The first one is that the survivability of the virus increases. Now we know that at certain temperatures, I'm forgetting the actual temperatures, on glass surfaces, it can survive for up to 12 hours. But when temperatures are cooler, as we are now in winter, it can survive for longer. Right. So on a door handle, for example, where we've heard that it can survive for 3 hours, I think, because the temperatures are cooler, we can expect that it survives longer, so that it increases the exposure risk. In addition, because it's cold, we are all confined indoors, so social distancing again becomes a bit of a problem.
So in that, you were saying something about the handles, the door handles, etc. We are looking at students who are at a university, who are possibly, yes, some colleges are arranging that students want to be sharing accommodation. What can you recommend? Can sanitization of our hands be effective? What can be effective for the young people?
Yeah, I'm not sure which university will be able to offer students unshared accommodation. Yes, the room might be unshared, but the bathrooms are shared. The dining halls are shared. There are a lot of common areas. The libraries are shared, right? So we would need the universities to convince us what sanitation programs they've put in place, right? Some companies are recommending desanitizing commonly touched areas every 3 hours, and then massive sanitization at the beginning and at the end of the day. So winter increases the exposure risk because of the factors that I've mentioned. Okay. I'm particularly concerned. I mean, I did my studies at the University of Zimbabwe, and in our corridor, I think there were 28 of us, because there were 14 rooms, and we had a bathroom at the end of the corridor there, right? So yes, you can put me in my own room, but I'm still going to go into that.
Into the common
room. And I might get into it 5 minutes after somebody who might have corona, or I might have corona and somebody comes in 5 minutes. So what sanitation program have they put in place for those commonly touched areas? I also need to highlight another area here which has been of concern to us for a long time. The University of Zimbabwe Medical School, as it is currently configured, it was configured for less than 100 students, right? But it now has an intake of 200 students per year. Right now, this year, because of the strike last year, we have got 400 students that need to write examinations, right? And these students...
So that's 4 years packed in one.
That's
practically.
Yeah. So they will need to go into the wards, because part of the examination is a practical examination in the ward. Okay, is the University of Zimbabwe going to provide PPE for these students? This is a major source of
certainly those are questions that need to be answered, and those are real crises that we're facing, and the potential for crisis seems to have grown. And when you're talking about those shared bathrooms, you wouldn't know that as a woman, but these gentlemen will know you've got a urinal over there, but for some funny reason somebody decides to go into the shanks, and you'll find there must have been a sprinkler in there, because our habits are totally different. Some will, there's an artist who said, so you...
that was maybe when I joke in the interest of time. I've seen my temperature being checked by every Jack and Jill. What's your comment on that? I remember somebody teed up in a shop, the temperature was like 34 degrees. Then it's like, no, let me start again, etc. Maybe what's your comment on that in terms of, yes, mechanisms are being put in place at workplaces and other public spaces where they are making sure that if you don't have a mask, you don't have to get in. If you don't sanitize your hands, you don't have to get in. If I don't check your temperature, you don't have to get in. But I'm worried with the young people are also worried with those who are controlling the thermometers.
Well, yeah, I've experienced the same thing where my temperature is recorded with using an infrared thermometer for that matter. Is recorded as 34. Come on, that just should not happen. You know, a normal temperature for a human being is 36 to 37. A temperature below that, you have to question the validity of the instrument, because that is being used. But checking temperature in itself is a public health intervention. It has been shown to be effective. How is it effective? If you have got your temperature, right, we make an assumption at that point that you may be infected, and we then direct you into the right pathway for you to be screened and so on and so forth. So it is a right public health intervention, and it has been shown to be effective.
When the equipment is, of course, functional. But, of course, we're going to take a bit of a breather. Very, very interesting discussions that we're having today as we continue on issues around our adolescents. And when we come from our break, we will have one of the people we are talking about, a young student, those adolescents who we are saying should be a part of this matrix. We'll be back in a heartbeat.
Life will never be the same again.
Absolutely.
No.
How do you tell someone in Bari or in Soweto that they should exercise social distancing?
Every single one of us, barring a few, are praying more.
What is the health economic cost of what we are trying to achieve?
I don't know whether his chairman knows he runs at about 9 in the morning.
Yeah, I've just got symptoms, so I just called the doctor and I just then he just advised me to have to stay at home, eh?
Welcome back to Heartbeat here on Zimbabwe's television network. If you're just joining us, you're here at the dying embers of what has been a very, very great interaction that I've had with my guests. And if you started from the top, you will know we were expecting that we are going to round off with words. And of course, we've got the gentleman here, we've got Thabo. You're pretty much the owner of this discussion. You've heard what everybody was saying here. Before I get back to them and then we start to round off, I want you to speak on behalf of the adolescent community, basing on what you were hearing the director of SAYWHAT, Penelope, and Dr. Boboto saying here, which of course directly impacts you as a student, and I believe Great Zimbabwe University, that is.
Yes, that is true, Robert. Just basing on what they were saying, it's very true that in terms of COVID-19, youth, young people have been affected and infected directly by the coronavirus because of what short-term effects and the long-term effects. Because we're looking at those final year students right now who are writing their exams, even if they manage to write their exams. What happens? What is the perception when you're looking for a job in 2022, 2025? We know that we spent almost half the semester at home. So even when you're looking for a job, the person who's actually interviewing you for the job, the perception that they have towards you is actually quite biased. In terms of like the way you completed the degree is quite biased. You didn't do.
It's like the way Liverpool is going to win the league this year, isn't it? COVID. So I totally get
those
it.
kinds of long-term effects are there, and definitely the issue of PPE within the institutions is quite something that we also have to look into. Definitely, yeah.
Okay. No, but You talked about, and these are the indirect effects, as it were, because somebody's going to look at this here and say, well, these are the half-made buns, and they're going to have that prejudice against people like Thabo. What are other, quickly, what are other indirect, you talked about gender-based violence, for example, because somebody's going to say, I was affected, and you say, well, did you get COVID? No. Did a relative get COVID? No. But being in the home and being beaten up because of something else that is abstract, that's an indirect something. But what are other, perhaps you give us one, and Doc, you give us one, perhaps real quick.
I would like to maybe take us back to that issue of mental health. You know, like this COVID has come with it some restrictions in terms of movement, how young people socialize, the social support structures that they have, friendships and all, and this is all like has just, the scenario has just changed. So you find that a lot of young people may be experiencing issues to do with depression, issues to do with how do they cope with all this information, and even the experiences that they're having. Issues to do with substance abuse also, and we really need to be to take note. Issues on how even like their menstrual health is also getting affected, access to these products, and even to the support structures that normally exist in a normal functioning environment and community. So you find there are a lot of those burdens that young people have to live with.
And Doc, you were talking during the break about something to do with nutrition, and perhaps real quick, can you just wrap that up for us?
We have discovered that particularly among young children and the elderly, people that we're now beginning to deal with acute malnutrition. These are people whose livelihoods have been totally disturbed, and access to food, nutritious food,
especially during the lockdown.
Acute malnutrition has become a problem. But let me also highlight another major indirect effect of COVID. The radiotherapy machine at Harare and UNFPA hospital is not working, not through fault of anyone. It's a machine, it breaks down. But the technicians that service these machines need to come in from South Africa, right? And we are not allowing in people to come in. But when they come in, what do we do with them? Do we isolate them first for 21 days? And then they attend to the machine, and then when they go back to their own country, they're going to be isolated again. So our cancer patients are not accessing, the machine in Bulawayo is working, but movement
from Harare to
is restricted.
But Doc, I will have to hold you there. I'll be bringing you back to another of our shows. It's a COVID-19 show called Diplomatic Passport, because those are very important issues, especially COVID and cancer, which is something very close to my heart as well. But perhaps as somebody representing the youth today, what is your final thought? What do you have to say with regards the experiences that you're going through, especially also for the fact that you are a leader amongst the student fraternity?
Definitely. I feel we have a lot of work to do in terms of minimizing the effects of COVID-19 on the youth. Because even other long-term effects, we're looking at unplanned pregnancies. Because the UN has said that we're going to experience maybe 9 to 18 million of unplanned pregnancies during COVID-19, simply because we've got a shortage of contraceptives, which youth can access, and also the freedom of access, accessing these shops or these retail shops is limited. So those are a lot of problems we're going to have. So I assume what we can do, some of the recommendations I can offer is we can also include a lot of psychologists in terms of the psychosocial well-being of the youth, young people of today, especially those who have been infected, because they're also affected of stigma, as said by Penelope here. So I think those are some of the things that we also have to look into during this COVID-19 period.
Thabo, on that very profound, very eloquent recommendation process, I'd like to thank you, Doc Bopoto. I would like to thank you, Penelope. Thanks, Thabo. And of course, we had also the director of Say What, Jimmy Wilford, who was here with us earlier. We shall be seeing these same faces elsewhere on other programs. And as I said, we've got Diplomatic Passport, which will be coming, giving you those updates on COVID-19. I'm Robert Mkondiwa. This has been Heartbeat, and have a great afternoon.